Diphenhydramine is an antihistamine used to relieve symptoms of allergy, hay fever, and the common cold. These symptoms include rash, itching, watery eyes, itchy eyes/nose/throat, cough, runny nose, and sneezing. It is also used to prevent and treat nausea, vomiting and dizziness caused by motion sickness. Diphenhydramine can also be used to help you relax and fall asleep. This medication works by blocking a certain natural substance, histamine, that your body makes during an allergic reaction. Its drying effects on such symptoms as watery eyes and runny nose are caused by blocking another natural substance made by your body, acetylcholine. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products, such as long-acting tablets/capsules, are not recommended for use in children younger than 12 years. Ask your doctor or pharmacist for more details about using your product safely. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. When taking Aler-Caps, it's important to follow the directions on the product package. If your doctor has prescribed this medication, be sure to take it as directed. If you have any questions about your dosage, don't hesitate to ask your doctor or pharmacist. You can take the tablet, capsule, or liquid form of Aler-Caps by mouth, with or without food. If you're using the liquid form, make sure to measure it using a special measuring device/spoon, and not a household spoon, to ensure you get the correct dose. If you have a single-dose form, like a single-use whistle, you won't need to measure the dose. For the rapidly dissolving tablet or strip, simply allow it to dissolve on your tongue and then swallow it, with or without water. If you're taking the chewable tablets, be sure to chew them thoroughly before swallowing. The dosage of Aler-Caps will depend on your age, medical condition, and how you respond to the treatment. There are different brands and forms of diphenhydramine available, so it's important to carefully read the dosing instructions for each product, as the amount of diphenhydramine may vary. It's important not to increase your dose or take this medication more often than directed. If you're taking Aler-Caps to prevent motion sickness, be sure to take your dose 30 minutes before starting the activity, such as travel. And if you're taking it to help you sleep, take your dose about 30 minutes before bedtime. If you continue to have difficulty sleeping for longer than 2 weeks, it's important to contact your doctor. And as always, make sure to inform your doctor if your condition does not improve or if it worsens. Side effects of Aler-Caps may include drowsiness, dizziness, constipation, stomach upset, blurred vision, or dry mouth/nose/throat. If any of these effects last or get worse, tell your doctor or pharmacist promptly. To relieve dry mouth, you can suck sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. If your doctor has prescribed this medication for you, it means that they have determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. However, if you do experience serious side effects such as mental/mood changes, difficulty urinating, fast/irregular heartbeat, or seizures, it's important to tell your doctor right away. Also, seek medical help if you have any very serious side effects, including a very serious allergic reaction. This is not a complete list of possible side effects, so if you notice anything else that concerns you, don't hesitate to contact your doctor or pharmacist. As always, if you have any concerns about the side effects or the use of Aler-Caps, it's important to discuss them with your healthcare provider. Before taking Aler-Caps, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that can cause allergic reactions. It's important to also let your doctor or pharmacist know about your medical history, especially if you have breathing problems, high pressure in the eye, heart problems, high blood pressure, liver disease, seizures, stomach/intestine problems, overactive thyroid, or difficulty urinating. Aler-Caps may cause dizziness, drowsiness, or blurred vision. It's best to avoid alcohol or marijuana while taking this medication. Also, be cautious when driving or using machinery until you know how this medication affects you. If you have diabetes, liver disease, phenylketonuria, or any other condition that requires you to limit sugar, aspartame, or alcohol, make sure to ask your doctor or pharmacist about using this product safely. Children and older adults may be more sensitive to the side effects of Aler-Caps, so it's important to monitor them closely. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of taking Aler-Caps with your doctor. It's important to be aware of any potential drug interactions that could affect how Aler-Caps works or increase your risk of serious side effects. Make sure to keep a list of all the medications and products you use and share it with your doctor and pharmacist. It's also important to let your doctor or pharmacist know if you are taking any other products that may cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Additionally, check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. It's also important to be aware that this medication may interfere with certain lab tests, so make sure to inform the lab personnel and all your doctors that you are using Aler-Caps. If someone takes too much Aler-Caps and experiences serious symptoms such as passing out or trouble breathing, it is important to seek emergency medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, seizures, and widened pupils. In children, mental or mood changes such as restlessness, irritability, or hallucinations may occur before drowsiness sets in. Make sure to schedule regular medical and lab appointments to monitor your health and the effectiveness of Aler-Caps. This will help ensure that you are taking the medication properly and that it is working as intended for your specific needs. If you forget to take a dose of Aler-Caps, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Aler-Caps, make sure to keep it at room temperature, away from moisture and light. Avoid storing it in the bathroom and do not freeze the liquid forms of this medication. It's important to keep all medications out of reach of children and pets. When it comes to discarding Aler-Caps, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly dispose of the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for proper disposal methods. Remember, always follow the instructions on the label for safe and appropriate use. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.